Okay, should be good. All right, so we should be good on LinkedIn now. We're good on Facebook. We're good on YouTube, Twitter, and Twitch. Just checking for the Instagram. Just bear with me. Okay.
And how long does it go for?
We roughly go for about half an hour, but okay. We'll see.
Yeah, that's fine.
With all tech, there's always a bit of technical difficulties.
Oh, I always love it when young people have technical difficulties.
I think I'm worse than all of you combined. My facade is a young person, but my technology skills is that of an old person. Very old person.
I'm sure they're not. I'm sure you're better than you think. That's what my dental assistant said to me. You're better than you think, actually. I went, oh, that's nice.
I think my classmate took the mouse away from me. She's like, oh, you're just too slow.
Oh, that's brutal.
I was like, it's okay, I accept this.
Yeah, that's right. Do it for me. Yeah.
Okay, let me try that again. Sorry guys, everyone that's watching on live right now. I'm just trying to get our Instagram to connect. Okay. Okay. Sorry guys, just bear with me.
Are you both in Melbourne?
I'm in Melbourne.
Yeah.
And so are you, I remember.
Uh-huh.
And I think Laurence is in...
I'm in Sydney. Yes.
We're all in lockdown then.
Yes. All right, now we're good on live. Okay, thank you. Thanks for bearing with me, everyone. Now we're live on Instagram as well. So, everyone, welcome to the CPD Junkie podcast, where every Tuesday night at 8 p.m. we bring you interviews with the dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Laurence Doan, we've got your co-host, Jen Trung, and tonight we've joined by Dr. Helen Marchant.
Hello.
Helen has worked in Special Needs Unit at the Royal Dental Hospital Melbourne for the past 17 years and in private practices dedicated to special needs dentistry since 2011. She has held appointments at visiting specialists. We're just waiting for Jen to come in. She's held appointments as visiting specialist to the Peter McCallum Cancer Centre and is an active demonstrator for the University of Melbourne, the Special Needs Dentistry Department. In 2020, she became a fellow of the International College of Dentists. Helen has developed a particular interest in treating people with developmental disabilities such as autism, Down syndrome, cerebral palsy, and also enjoyed assisting older people who may have complex medical histories and or dementia. She has a holistic approach towards dentistry, developing treatment plans to suit each patient's individual needs. Dr. Helen Marchant, welcome to the show.
Thanks very much, Laurence. It's a pleasure to be here.
So, Melbourne is in their 6th lockdown, and many people are talking about lockdown fatigue. How are you going? How's that kind of impacted your work?
Yes, it is very difficult, but a lot of my patients are really, they're very understanding, and a lot of them are quite isolated anyway. We talk about, physical distancing and self-isolation, etc. But, a lot of my patients, especially people with mental health issues, don't go out very much. And, in the early days of COVID, we were saying, have you been to these exposure, we still ask it now, exposure sites, and no, we haven't been anywhere. And actually during lockdown, because dentistry is a, authorised service, they've been very excited to be able to come out during lockdown to go to the dentist. So I must say, a lot of their conditions are obviously, we've got to be careful because the ADA has told us, we've got to use our judgment and only see people where their conditions might deteriorate. But I think with a lot of people with disabilities and special needs, they really, sometimes you can't examine them properly and their parents are very worried, etc. So just to give them that little bit of normalcy, I have definitely scaled down and don't see quite as many as I usually do. But, I feel it's important to be there for them. And it's very nice when they say, oh, I'm so excited to come and see you. And, we're literally coming from home to the dentist and then back again. And I really know that that's what they're doing and they really value, coming to see us. So we try our best, to do all the, obviously we stick to the regulations, but, there's a little bit of, little bit of leeway, I think, we give ourselves. And I think that has really helped. Yes, it's lovely to support people as much as possible, really, in these times.
Has that been different this time around compared to the first lockdown last year? Or?
Well, yes, it's definitely more fatiguing now because when we were in the 3 months, this time last year, we didn't really know we were in it. Whereas now I get the feeling that we're just starting into quite a long period again. So, that's that. I think that is hard for everyone. So I think it's really important to reach out to as many people as you can and try and talk and do these kind of things and stay connected as much as you can. So I think everybody's doing it tough now. I was at some home visits today. Again, people, worried about their teeth and they want some reassurance. And it's really difficult. But on a plus, everyone that I saw today was vaccinated. All the disability workers have been vaccinated. We've all been vaccinated. So, there's a little bit of hope, isn't there, with that, we think.
Yeah. A bit more trend towards normality again, I guess. Living with COVID, I guess.
Yeah.
So before you were solely a special needs dentist, you were a general dentist. In fact, you're a UK community-based dentist, What was your CPD journey at that time?
Yeah, so it was quite interesting, really, because when I finished university, we did in the UK, they do the same model in New Zealand, actually. They have house surgeons, so you can work in general hospitals, and it's generally oral surgery and orthodontics. So I got quite interested in oral surgery. And so that's what I started doing. But then I realised it was a really long study period. And I actually, by default, I sort of got a job in community. And I realised then, I suppose that's what attracted me to oral surgery as well, is that I was much more interested in the medical side of dentistry, perhaps. And also, you know, dentistry in different settings, and looking at some of the barriers towards dentistry, and how it can be applied. I mean, I think it was the variety of work that really attracted me to community dentistry. In the UK, it's predominantly children. But obviously you're working in different schools and settings, and there's a little bit of disability as well. But I think the variety I really enjoyed that. Plus the medical side of things, you know, going towards special groups. But I always wanted to travel overseas, and I always wanted to do voluntary work somewhere. And that's what sort of got me on the path to coming to Australia, really, because I worked in India and I worked in Nepal and Israel as a volunteer, and community dentistry really sort of set me up very well for that, because, you know, I wasn't working in a conventional dental surgery, you know, and you had to be really careful about your resources. You know, you had to really make things last and do a lot with, you know, sort of what you had. So that was really a great experience when I was doing the voluntary work. I always felt that I got more out of it than anybody else did. But I guess, you know, I did do some dentistry and did get people out of pain, etc., along the way. And that's how I sort of found myself in Australia, because I met some Australians on the way in India, and I sort of travelled on with them. But I never wanted to work in a city. I came to Melbourne first, but I really wanted to go to the outback and work with, you know, Indigenous people. So that's how I ended up sort of working for 10 years, almost 10 years in the Northern Territory, and doing the flying doctor service, dentist service up there. And again, you know, different settings, and that's where I sort of, so I guess, you know, obviously I'm interested in teeth, but I'm really interested in the bigger picture. So looking at the whole body and then maybe the whole community. So then I heard about, and you might ask me later, but one of my influences was special care. They refer to it as special care dentistry in the UK. Special care specialist over there, one of my colleagues, she was in London, and she told me about the fact that King's was starting a Master of Science course in community dental practice via distance learning. So this was a huge, you know, CPD for me, because computers were just starting to come in. This was early 90s, or certainly just starting to come into my world anyway. I know they were invented in the 50s or whatever it was, but so there I was, sort of in the very remote communities in the Northern Territory. I never worked in Darwin. That was my recreation spot to go to. So main centres I worked in was Nhulunbuy, which is in Gove, which is right on the corner tip of Arnhem Land, on the northeast tip, sorry, I should say, and Catherine. And also a little stint in Tennant Creek. So I knew the territory quite well. And that's where I did my distance learning with King's College London. And that was amazing because, you know, when you're studying and you're applying it in your everyday work, it's amazing, you know, because I was writing about, you know, the challenges of the communities and what I could bring to the communities and what the barriers were. And then there was a summer school every year that I went back to London for a couple of weeks and met up with the other people who were in other parts of the world. And, you know, obviously that was, you know, really amazing. So they were always asking me about crocodiles and, you know, all that
shrimp
kind
on the
of
barbie.
It was this, yeah, that's right. It was this big and the teeth were this big. Yeah, so so that was really amazing to be up there. Yeah.
So let me backtrack a little bit. So you graduated thinking you're going to do something in oral surgery, but you end up at community clinic in the UK where you're dealing with a lot of kids.
Correct.
But at the same time, you've got a passion for traveling. You wanted to get out and be more than just about the teeth, about more than the person. You're more about the community and how it kind of all affects. So you're traveling overseas and then you get there and then you're meeting lots of people on the way and then you meet some Australians who draw your attention to Australia. And then you're here now in Australia and then you move out to the outback in Northern Territory and you're spending a 10-year period there with the Indigenous community, and you come across a course that a friend has mentioned to you over in the UK. Now, was she already doing this course, or was that something?
No, she was doing the conventional course at King's. What was she doing? She might have even been working there. Special care or special needs wasn't a specialty then. So she was sort of working in, I know what she was doing. She was one of the pioneers in treatment of people with HIV/AIDS in London, because it was late 80s, early 90s. And she was making an incredible, impact in that field with the infection control, etc. And so she actually set up a clinic predominantly for people with HIV/AIDS. And so she was, inspirational in that way. And she had, through her connections, she heard about the course at King's. Sorry, go on. So that's how I really came to do it. And both our careers have sort of evolved. And I still talk to her. And also during COVID, one of our friends has got together a Zoom group of all my, not all, but about 10 of us who graduated together in the mid-80s from Birmingham. Every Sunday we catch up. And Debbie's one of those people. So it's really lovely to be still in touch with her and talk about, how our careers have gone and what's happening now. So she works in community dental practice, treating adults predominantly, and she's now a specialist in special care dentistry because the UK adopted, it was the New Zealand and Australia were the first to make it a specialty, and then the UK and US sort of followed along, which that's a whole So that was mid 2000s. I don't know whether you want to ask me another thing or I can talk forever. Obviously.
Well, okay, so this new special needs is not a thing yet, and it's becoming a thing. Yeah. So then there's this course that you're recommended to attend. Yeah. I mean, did you have any prior information as to what it was going to be about, how it was structured? And then, what kind of compelled you to say, okay, well, this course sounds interesting. It sounds like it aligns with the things that I'm doing. I want to do it. And not maybe consider something else. Because like you said, Australia and New Zealand were kind of adopting this as a specialty. So that was maybe a realm for that here as well.
Yeah, well, because I mean, my oral surgery has always stood me in good stead, because I find myself in predicaments in the outback, in wherever, taking teeth out, and I always, I've always liked that part of it. So that's been good. Where was I going with that? So the experience in community, I know. So I was using that skill up in the Territory. I mean, I guess one thing about working up there, and one exciting thing was, for my big research project that I did with my master's, I did a health promotion program, which involved making a video promoting oral health. And so there was some teachers from Darwin, music teachers, and they had got groups together of Indigenous people making, and one of their projects was for them to write a song about teeth. So for me, it was a really living thing. The Indigenous people were doing these music workshops with these teachers, doesn't sound the right word, but the specialists, special music inspirations, really, coming from Darwin, and getting the band together. And funnily enough, I needed a song about teeth to go on my video, and so they produced this song all in their Yolngu language, so I did this health promotion project, which was incredible. And to go back to your original question, the course that I did in King, community dental practice. So that was really the emphasis of the course. It was about the community. So a couple of things that I really learnt about oral health in these, or health in general. The most important thing in Indigenous communities is people's diet and also environmental health. So, and these two things really impact oral health. The diet, obviously, but also the environment. Where do you keep your toothbrush? Have you got a clean place to put your toothbrush and to keep your oral hygiene products, etc.? Often people don't. So that's a big barrier. So it was really sort of looking at those community aspects that you just don't learn in your undergraduate dental degree. The other thing that was really amazing about the course in King's was that when we went on our summer school, we had to spend some time in a nursing home, an aged care home, and we had to critique, what we thought was good and what we thought was bad about or not so good, about the actual nursing home itself. What was the care like? What was the, what was your general impression of the place? So and then you sort of homed into the oral health care, but the oral health is just a small part of everything else. So that really had a big impact on me, I suppose, as well. And that's where sparked my interest in geriatric dentistry or gerodontology, which I do a little bit of now. I really enjoy, and this is something that actually I do talk to. I have given some lectures about to undergrads, because I think this is an area of dentistry that every general dentist is going to face. We're all living longer and keeping our teeth longer. So, so gerodontology is a very relevant sort of field of a part of special needs dentistry, but also it will be something that general dentists will need to look into more, I think.
Right. So you're saying that the community dental aspect of it that they were talking about was really kind of what empowered you to kind of take this course amongst other courses that were out there.
Yeah, for sure. I don't think I looked at any other courses. My friend Debbie just said, do this, and I did it.
So you do this masters, right? Yeah. And then you ultimately at some point return to Melbourne and specialize. Tell us about.
Yeah, so what happened was, much as I liked taking teeth out, I realized that unfortunately, that was probably the main thing I was doing up in the Territory. And, I was trying to do the health promotion preventive aspect. And that was working to a point, but still a long way to go because the services are still were quite sporadic. I mean, I wasn't, I couldn't be in all the communities at once. And one golden rule of health promotion is you can't promote health and promote prevention without providing the core services as well. You can't just, people still have toothaches, they still have, other things they need tending to. So, so the dentistry side of things, I was thinking, yeah, it's great taking teeth out. But I suppose I was getting more and more swayed towards, with the community aspect, of course, you get into policy and, dental public health policy. How do you change things from, why am I standing there taking teeth out all day? I don't want to be doing that. And that's not good for the community. As a dentist, I can't change that. I've got a queue a mile long outside, people with toothache, and you just take teeth out. With the health promotion project, that's what you're trying to change. But also you need support from above the health department, the policymakers. Where are they going to put the funds? Are they going to put funds into health promotion, or are they just going to continue to put funds into taking teeth out and then nothing will change? So I suppose at that stage I was getting more interested in policy, and through another Birmingham contact, Nikki Kilpatrick, who you probably perhaps know, she used to run the dental clinic at the Children's Hospital here in Melbourne, and she's still a big influencer in Melbourne dental scene. She heard that they were looking for a policy advisor in the health department down in Melbourne. So here I was up in the Northern Territory with the crocodiles, and and I hadn't really had much experience in policy, and I was so fortunate to have a position with Dr. John Rogers in the health department, DHS as it was then, down here in Melbourne. So I moved from into the big smoke down here, and I had a desk job, and this was a really new and exciting time for me as well. And fortunately, John said he said, look, I advise you don't do the policy work full time. I think you should do a day a week clinical. So I worked at a community health centre in Prahran. It was called Inner South Community Health Service back then. It's got a new name. I did see it recently. It's near South Melbourne Market and in Prahran. And there they had special needs programs. They had HIV/AIDS program, they had homeless program, they had people affected with drug and alcohol, they had mental health, which they called dental as anything, and they were very innovative, and it was really an incredible community health centre to work in. So I was there for a day a week. And so that was, again, getting me into the community dental practice side of things. But I had experience with the rest of the week in policy. And I realised policies, it's very challenging. and I enjoyed it and really got to understand how things, work and how everything, and the funding and trying to get funding for dental, in this big pool of money, which is the bucket, the budget, the health budget. We're a little small fry in oral health, and sort of John Rogers, just did an amazing job constantly trying to get more funding for oral health. And so that was an incredible experience as well. But I guess my heart lies in the clinical work, really. And I really enjoyed that time. So ask me about my next CPD.
which is where you'd come to specialize in.
No, actually, because I just thought of another one. I did a business management diploma. Well, I started it up in the Territory and I finished it in Melbourne, and it was through University of Adelaide. And it was really it was called public sector management. That's what it was. So that was not dental. And that was really fascinating because we had people from the public sector from all different departments, police, firemen, fire service, other parts of health. It was very competitive to get into it. And because it was, it was going, people wanting to go higher up in policy and, in their various departments. And so I finished it off in Melbourne, and I, as my project with that, I had to do a review of a service. And so the health department wanted to review the Kew residential services, which was a big facility for people with disabilities. This is where disability comes in. So in Kew in Melbourne, big facility, and it was reviewed with a view of closing it in the late 90s. So I just sort of, and they had a dental clinic there. And so I found myself reviewing this service, and honestly, that was a huge learning curve, to actually be there with my clipboard and pen and paper going and interviewing people and, looking at the sort of services that they needed and they were providing in the dental clinic, and writing all that up. And that's where my real interest in disability and developmental disabilities, sort of started. And at the same time, special needs dentistry was becoming a specialty. And so I left the health department and went to work at the dental hospital in the special needs unit with a view to specialising. So that's how I came to, be specialised in 2005.
Wow. And then you threw yourself back into the books to go and study to specialise in and finally specialise.
Yes, correct.
Was it what you expected it to be?
Well, there was no course then. So they call it, so I was sort of grandfathered into the specialty, but that doesn't mean it certainly wasn't easy, because we had to pass the fellowship exams at the Royal College in Sydney, and so our RACDS, and we had to have a logbook of all our patients for the past couple of years to show our experience with special needs patients, and we had to do some case reports, and we had to do the exams. So it was it was a sort of self-directed, really, I suppose, course in a way, because there wasn't a course. And so that's where at the dental hospital, I got the patients for my case reports and my logbook, and managed to excuse me, jump that bar regarding experience. And then I went to Sydney to do the exams, and I was 3 months pregnant with my son at that stage. So, and he was diagnosed to be autistic when he was just before he was 6. So anyway, great leap, but it all kind of all fitted in together. So right. So I managed to specialise, and then the next year my son arrived. And that's the next chapter.
So I think Jen's got a question for you. Yeah.
Well, so you know that I'm an undergrad. I haven't graduated officially yet. So we're taught special needs, but not as much emphasis goes on it, like, crowns, bridges, the endo. What are the highlights that you cherish and some of the challenges you face in special needs?
Well, obviously, I didn't really know much about disability. Going into that residential home and doing a review, that was daunting. That was really challenging. And, some of the assumptions I had, I think that, the challenging thing was just putting your foot into a whole new world. But that was the beautiful thing as well. And that's the thing that I think the families, are the main, the highlight of special needs dentistry, and especially with people with developmental disabilities. So this is disabilities that people are born with. And it takes a huge adjustment, for families. So that's both the challenges and the sort of highlights, really. And I suppose, when my son got his diagnosis, it was, again, just, it gave me a real sense of other. And I think, being a professional person, and I guess achieved quite a lot academically, etc. You do realise you live in a bit of a bubble, really, and you just sort of think that things are straightforward, and one way of doing things. Of course, we all only know what we experience as individuals. But, I think it's really broadened my outlook to life, and also, being a parent for a start. I think any parent will tell you that, it's a huge change. But being a parent of someone who, thinks so differently to how you do is another challenge, and it's very enriching. So I can tell you, there's lots of little anecdotes and things, obviously through the time that I've had with in the specialty, and most of the time, it's very funny. I don't know whether that's helped. You mentioned endodontics and crowns and things. Neither of those things have been. I've done a lot of both over the time, and endodontics. Look, it's a good thing to know about and to be able to do. Definitely. People who are anxious often have to, leave their dentistry till it's too late and they need endodontics. So it's, you obviously need to be skilled in those areas. But I think there comes a point in your career which I think is really good, when you kind of realise that these are the things you enjoy and you're good at, and these are the things that you recognise that you don't quite so much enjoy and you're perhaps not quite so good at, but you know who to go to for help, and you know who to refer to, and so that gives you a great sense of working as a team with your colleagues, and that is really lovely. And I know a lot of general practices which work really well in that way. People might not have specialised, but they've got their things that they like doing, and they're best at. And I think that's one thing that is really good, because dentistry is very challenging and stressful at times. So if you can just concentrate on the things you like, that's really nice. But it's hard when you're starting out, because you've got to really have a bit of a base of a little bit of everything, and then you can start sort of doing more of what you like doing. So I think that's really important, to sort of don't try and be good at everything. I mean, some people are good at everything, but I think you don't feel bad if you don't feel you are good at everything, if that makes sense. But I mean, one challenging thing is with people with disabilities, there's often not a lot of choice in terms of replacement of teeth. I think that's really hard. That's a really, really challenging thing. And also the perception that everybody's having implants, with the media and the focus on that, that makes it really difficult, because people just assume that they can get implants and they don't realise that obviously implants need fantastic oral hygiene, and they can get peri-implantitis and other complications. So it's not for everybody to have implants. So that's a conversation that I have a lot, and that can be quite challenging, really, because people with disabilities often can't wear removable appliances. So that's really hard, but you've just got to have a very pragmatic approach, really, and sort of it's really about, if people aren't concerned so much about aesthetics, or if they aren't concerned about function, I mean, if they're functioning okay in terms of eating, then you can be much more practical about what you're going to provide for them. Those are the two real things that you've got to consider.
Well, that's right. I guess it is interesting, because for many graduates who come up with not a deep understanding of special needs, they come across these patients with these developmental disabilities, and like you said, by no means is it easy, and you've mentioned a few things already, but are there any other particular tips and tricks that comes with managing these cases? Is it about having the whole team kind of ready, prepared, like sensory toys that you might use?
Yeah, I think preparation is the main thing, because I think what happens is general dentists, they might get somebody with a disability coming in, and they don't know anything about what's they're just completely unprepared for it. So it starts right at reception, and you hope that the person who's booking the person with disability in will tell, will give some information, but the more prepared you can be, so if your receptionist tells you, somebody made a call today and they booked in their son and he has Down syndrome, and it's and we thought it's in your book for a week's time. Well, then you can prepare, and you might ring the parent and say, I believe Trevor's been booked in with me, and can you tell me a bit about him, and how will he be when he comes into the room, what does he like, what might put him off, has he been before? So you can just get those questions. And I think if you only have a person with disability every now and again, then you can spend that time finding out about or talking to colleagues, etc., and saying, what's the best way to approach this person, And the thing is to remember is that the family knows that person the best, and they will be an expert in that. in the syndrome, you know, whatever it might be, and don't be scared to ask them, and don't feel that you've got to be an expert in that particular. I mean, I picked a reasonably common chromosomal sort of syndrome, but you know, there are thousands of hundreds of of different chromosome, you know, aberrations or syndromes, etc. And you can't, you know, hope to know. And that's where the internet and having your, you know, you can just Google stuff. You can look at, you know, there are some very good sites these days. I mean, when we first started with the internet, you know, you still have to be careful which sites you go on. But as you know, there's some, you know, you can get some amazing information at your fingertips. And so you can look things up very quickly. And parents really appreciate, you know, they don't expect you to be, you know, an expert in it. But they do expect you to have an inquiring mind and to ask questions and to be interested and to listen to them. And so it really is about engaging the team, you know, saying, oh, look, I don't know much about this syndrome, you know, can you tell me about it, and how does it affect Trevor, you know, your son? And you know, that way the parents or the carers, you know, they feel that you're trying your hardest to understand and to engage. So I think that's the real, so having that interest. It really makes a huge difference. So in my registration forms, every patient I have has special needs, obviously. And so we have the registration form, and people can put, you know, there's questions about, it's on my website, and, you know, questions about what might frighten them, or what might motivate them, or what might calm people down. You know, so you can just get some pointers. And after you've been doing it for a while, you know, you can see some common themes. And that's the part that I really enjoy, is seeing a new patient who I don't know anything about other than what they've written there. And you just sort of embrace the situation. And we had a parent, you know, a father lying down on the floor with his son lying on him, autistic boy. And, you know, you just go with it. You have another one who's climbing up on the cupboards, and you're just like, oh my gosh, you know, don't fall off. You know, that you give them time, I suppose, and you work with the people that they're coming with. So, you know, it's about slowing down and trying to not have that sort of fix it mentality, because we're practical people, you know, we're fixing teeth, we're doing stuff to teeth, and we're getting every little bit off, you know, calculus, and we're, you know, perfectionists. You've got to sort of step back from that and look at the person, and then, you know, you aim for, is he going to sit in the chair? Is he going to stand up? Is he going to sit next to his parent? You start with a toothbrush, that's something familiar, and then the parent says, oh no, he really hates having his teeth brushed. So you go, oh, that's not going to help much then, is it? You know, a face mirror, does he like looking at himself in the mirror? You know, that's, so these kind of tools, you sort of really strip it back to the basics, really. If you can get a visual examination and just building up trust, and YouTube and a screen definitely helps too. So, you know, yeah. It's all that. It's having fun, really.
Yeah, no, I hear what you're saying, you know, so a lot of this is about slowing down the procedure, giving time for everyone to kind of feel comfortable, work out where the comfort zones are, you know, and then trying different things. I mean, there's no way to know until you try it, unless they've told you in prior experience. So no, I hear you. So on top of that, you know, to add an extra level of difficulty, patients sometimes come from non-speaking English backgrounds. You know, you've had the experience of working in an Indigenous community, but in maybe more metropolitan communities, still there are people that might come in that don't have an English speaking background. How do you kind of tackle that kind of issue?
Well, I mean, I guess technically we try to get interpreters wherever we can, if we need to. And again, you know, it's, I mean, I suppose communication is, we put a lot of emphasis on the verbal communication. And obviously we've got to make sure people understand in terms of consent, etc. But a lot of communication is through body language and tone of voice, etc. So it's really, I don't find it too much of a problem if you're using an interpreter as well. You've got to be careful using family members as an interpreter. I mean, that's, you know,
some bias.
Across the board. Yeah, across the board, you've got to be careful with that. But there are some very good phone interpreters that you can use. And I guess people with disabilities, people with developmental disabilities, I guess there are a lot of people, I was thinking about this today because I saw that you had a question about that. And I don't see, not in private practice, I don't see too many people with who don't come from an English-speaking background. And I just wonder whether, I guess immigration policies are pretty strict, and people with disabilities who come from overseas, I don't know. I don't know whether they, you know, have access to coming to Australia, you know, as much as other people do. I mean, I'm sure there's some kind of, difficulty with emigrating to another country if you've got a person with a disability in your family. So, you know, we probably don't come across that. So
no, I hear what you're saying. So they're probably, a situation would probably be like they've already made contact with someone else prior to yourself first, and they've already started to build a slow network, and then that community might reach out to yourself, and then they will have a representative that might be able to kind of communicate and understand.
Absolutely. Yeah, absolutely.
No, I hear what you're saying.
I mean, I guess I do have. There are parents. Yeah, I mean, I think to navigate, you know, the disability sector with, you know, you've got to have a pretty good handle on English, really. You know, it's really, I can see that it's a kind of a bias in the community that we probably don't have those families who are from non-English people speaking backgrounds with disabilities. So interesting point. It's very interesting.
Yeah, because I would imagine, like, if borders were open back up again and you were volunteering overseas again and you came across someone that had this kind of difficulty, and obviously you have a knowledge for it, but you've got a patient that doesn't quite understand what they're going through. I mean, I can only imagine the difficulty that might. But that's why we posed the question. You know,
it's a great question, definitely, and it makes me realise how much we, you know, we don't use the verbal. You know, you might simplify the language a lot anyway, and a lot of my patients are non-verbal, so you know, English as such is probably not so important a lot of the time. You know, it's in the day-to-day looking at teeth. Obviously you've got to, when people are going to general anaesthetics, this can be an issue. There's a lot of paperwork, there's a lot of things to digest. But again, you know, there are professional interpreters that you can help. And, you know, as you say, people have often got their own networks, and they've been navigating this for, you know, however old their child is. And so they're you know, it's sort of
there's a community and support network around it that's being built up.
There often is absolutely.
Well, Dr. Helen Marchant, thank you for coming on the show. You know, we've surprised, the time has definitely flew by. We had so many more questions we wanted to ask you, but let the people know how they can reach out to you or find you, and you know what's kind of going on in your life at the moment.
Okay. Well, how to find me? I mean, I do have a website, Western Special Needs Dentistry. So, you know, I'd love to hear from people. If anybody wants to come and spend a day in my practice and learn something about special needs. I suppose I should correct you on one thing with the introduction, because I don't actively teach on the university course anymore, but I used to. And I do know that the course, the specialist course with University of Melbourne, they have an amazing experience going to lots of different institutions, you know, the Alfred Hospital, Monash Health, and, you know, they really do get a good experience with, you know, the communities of special needs people in Melbourne. So, yeah, look, I'd love to come on again, and maybe we'll, you know, have some fun dinner or something.
Yes, another mukbang special. So for all our viewers, if you like this episode, definitely drop a comment below on your favorite part, but don't forget to like and subscribe. For all our listeners, if you like this episode, leave a review as well, and don't forget to share it with your friends, and we'll see you on your next episode of CPD Junkie podcast. Dr. Helen Marchant, have a good night.
Thank you so much, Laurence and Jen.